I'm Bishop Robert G. Brown. I'm the senior pastor of Zion Church Ministries in Everett, Massachusetts. And I'm here today with one of the esteemed physicians of Cambridge Health Alliance. With us, Christian. Could you just say your name?
Can I tell you a good story? I'm Dr. Kirsten Meisinger, but can I tell you my favorite time I was in the hospital? And you know how we work all night when we're in training, right? So I get paid, this person's paging Dr. Christian Messenger, and I was so loopy, right? I was like, that's me. She's paging me.
I could imagine,
was it a great
because
name though? Was it great?
We're so used to saying,
like, I should have that name.
Yeah, we're so used to saying Christian or Christian, and it's Christian. And
it's actually Kirsten. It's a horrible name.
Okay.
It's a horrible name to say in any language I speak, but it's actually a beautiful. I mean, some people like think it's a beautiful name. I love my name. My poor father who named me. Sorry, Dad, but it's actually a very hard name to say. I think in most languages, particularly the languages I speak, right? Spanish, Portuguese. Anyway, but yes, it was a wonderful moment. So, Christian Messenger. And anything in between that, my actual name, Kirsten Meisinger, I will answer to gladly. I think it's a wonderful story. It's still one of my favorite moments.
So I'm going to say Christian. That's close, yeah. Messenger.
Yeah, Kirsten's
Messenger.
Fine. Don't worry.
Yeah.
You know
because
what?
it's the first thing that pops up in your head.
And I remember Chris is what I'm called when I speak Portuguese and Spanish. So feel free just to go with that.
Okay.
Totally fine.
All right. And we're here tonight to talk about the ongoing progress of COVID-19 that we have been dealing with for over the last 15 months. And as we all know, the numbers have begun to come down, and a lot of the rules and regulations, restrictions are beginning to be lifted. We have been clapping our hands and thankful that those who have been vaccinated, especially both vaccinations, have now the ability to go into your favorite restaurants, many different places without masks, but more so than that, to be able to greet and meet with people that we have not seen for a long time. And this is a breath of fresh air. And so we want you to join in with us as we go down a list of things just to see where we are. And we know that this particular week, the last few days, we're in today is the 14th, 15th of June. And it is so good to look to see that the death rate has plummeted. There are very few new cases of COVID in the Commonwealth of Massachusetts. And we also still need to take time to congratulate these men and women, our first liners, our doctors, our nurses, all the healthcare workers in particular who have stood on the front lines for so long. And really, they're the ones who saw most of the suffering and the pain and a lot of the dying that was taking place, that even with them, they were affected as well. These are memories that they will have for years to come. But thank God, we're getting a little beyond this storm. By no means is it over. We still have to remain vigilant. We have to do what is necessary so that we never find ourselves back in this predicament again. And so, Dr. Messenger, it's good to see you once again and to be able to sit here on this evening and just talk about one of the things that you have become well versed in.
Sadly, I know a lot about COVID. I think I'd prefer not to, but it has been really helpful and just really important, I think. You know, one of the things I've been reflecting, my mom is actually a history teacher. She taught high school for years. And, you know, doctors have a very high death rate. Doctors, you know, traditionally, we're the first ones to go because people, when they're sick, come to us. We want you to come when you're sick. That is our job. We sign up willingly for it. And we had a really good run of it. You know, I'm in my 50s and hadn't really seen anything dangerous. So I'm really quite quite lucky to have gotten this far. And traditionally, usually would have gotten a couple different things in my career. So I'm glad this is over. It really does seem like it's over, which is amazing. Amazing.
Absolutely,
The
yes.
vaccines are insanely good. Really, truly, we were hoping it would be somewhere 70, 80% effective. Because you know what, honestly, the vaccines that we give to little babies, they're pretty good, right? They're sort of in the high 80s, low 90s for effectiveness. And that's why we have to give those boosters. You have to get a measles shot at some point sometimes, even though you have one when you were a kid. Certainly folks like us, we had to get another measles shot because they only gave us one when we were at like one, and then we had to repeat it.
Hmm.
So we don't know how long these vaccines are going to last, but we know that they work really, really well. And I think there's a lot of talk about the side effects, and that makes sense to me, right? Because then there are side effects. I had some pretty interesting side effects with the second one. I had pretty much a whole day where I was just kind of sitting on the couch feeling sorry for myself. And I knew enough to take that day, right? If you do that and go to work, you get through it. It's not terrible. It's just uncomfortable. But the side effects make sense because they're so strong. Your immune system, boy, is it paying attention. Your immune system, it's like, when someone pulls your face, like, that's what that vaccine does to your immune system. It's like, look at me, and it works beautifully. So we're fortunate. We're fortunate to have safe, effective vaccines. We have Moderna and Pfizer that have had to date almost zero side effects and really
Mm.
no deaths associated. That's also amazing. Johnson and Johnson is a wonderful vaccine. It really does look like, and I'm very proud that we actually as a country stopped everything, looked at the evidence, and
Right.
then decided to continue. It actually looks like it really wasn't, it was a lot of fuss about nothing, which is great. We're still tending to give that one to kind of older folks because it really was just young folks, particularly young women, who were affected. So if you're older and a guy, or if you're a guy, go ahead, get that one shot and just get it done with. But if you have any doubts, if you want to be perfectly safe in getting your vaccine, we have Moderna and Pfizer, both of which are available. You can literally walk in anywhere. And we're doing all these really fun events where we actually get to have a sort of party as everyone gets out vaccine and gets vaccine, which is a blast. And so thank you for hosting.
And that's so different than what it had been when this first started out, and we were trying to figure out how are we going to get through this. And now it's just like oh, I'll go to CVS and get a shot, or Walgreens or something.
Yeah.
It's amazing as to how far we have traveled over the last several months. I'm one of those abnormal people who, after receiving the second shot, I didn't feel a thing. And I could not
Oh, good
understand
for
why
you.
so many people around me were having these problems. I said, well, I don't know, didn't affect me. But
That's
that
awesome.
conversation has gone throughout the country with the second shot that people have gotten for the most part. Um, I heard there's a question that has been constantly asked now that we're down the road a piece, and after the shots, can you get COVID? Can you get the virus? I mean, is it
Mhm.
is it that foolproof that the virus will hit you again? And if so, what happens?
So it's such an interesting question, and it's the exact right question that I love to talk about, because it's not actually, yes, you can, right, you can get a new kind of COVID, right, because COVID's constantly changing, but it's actually, the vaccine isn't designed to have you never get it. The vaccine's just designed to keep it from killing you. So the reason I use the number 100% effective is because you are 100% guaranteed not to die of COVID if you get it again. And sure, I mean, people get stuff all the time, right? It's how does it change your life, right? If it's going to give you a little bit more of a cold, there are already people who've been vaccinated who've had COVID infections and they lost their sense of smell. They had a little bit of a cold. They didn't even
Right.
weren't even able to, they weren't contagious. They couldn't even give it to anyone else because the amount of virus that you have in your nose when you get vaccinated is tiny, 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 tiny. So even if your immune system can, right, has to take a little bit to kind of gather itself to get rid of the virus, and it gets into your nose and stays there, then right, at least 100% you're not going to go to the hospital, you're not going to need oxygen, and you're not going to die. So I think it's the question people ask, and it's actually kind of the question the vaccine isn't designed to answer. We actually, as a doctor, I don't really care whether you get COVID. I care whether you give it to someone who could die, or if you die or get really, really sick, right? I don't ever want this to affect you for the rest of your life. So the answer is yes, you can get COVID, but it's not clinically significant COVID, which is what we call when something really bad happens to you. So I sort of don't care. Not that I want anyone to get it. I'd rather it just not exist, quite frankly, right?
Right.
Because it's gonna over time evolve, and there's whole areas of the world that don't have vaccine that are going to wind up getting a whole new kind of COVID that might be able to infect us enough to get our attention. But I don't, this virus isn't very smart, it turns out. I don't think it's going to do much for years for us now that we've basically got a huge number of people in the US vaccinated. And I really do want to start to encourage people who think that they're not going to have trouble with this virus to go get vaccinated now, because no matter what the variants are coming, this particular vaccine works against them, again, enough so that it's not going to affect you, right? Like, okay, right, maybe you had a day of a cold, big deal. It's actually hard to remember what a cold feels like because we wore masks for so long and stayed in our houses. No one got sick, but
Absolutely.
they're not
Right.
fun. The big deal is COVID's miserable. You suffer and you could die. And young people are dying now. That's the thing that's scaring the rest of the world, right? The young people in India, the young people in Brazil, the young people in Nepal, they're going down like flies. And this is not an old person's disease. And we don't know if it's because it's in countries that are different from ours and just have a lower level of standard of living, so they don't have as good nutrition and they don't have as good hygiene, or if this is a new virus. And I don't think you want to take that chance when you have a completely safe option. So I would encourage everyone to get it for those medical reasons. And then, I wonder what you think about this, Bishop Brown, because one of the things I've been reflecting on is, this is the first time I've had to decide to get a vaccine. I've kind of had those decisions made for me my whole life, right? I didn't decide when I was a baby. I didn't decide when I got these jobs. Like, I had to get vaccines or to be a doctor. But interestingly, and I'm not totally sure how we got to this point, but it hasn't really been optional to whether or not you get a vaccine, because vaccines aren't about you entirely, right? They're about us. They're about all of us. They're about the community. They're about not
Yeah.
killing the nice lady down the street who you never really knew, but you didn't realize you had COVID and you said hi to her and now she's in the hospital.
Mm.
Like, that's what vaccines are for. So it felt weird to have to decide. It kind of made me pause. Like, do I really want to do this? And I was like, okay, knock yourself out of that. Stop that, Kirsten, right? Like, go get your vaccine. Don't be silly. But it doesn't feel totally right to me that it's a personal decision in a weird way, because there are people who the only way we can protect them is by getting it. And in this case, it's perfectly safe, which we know now, right? I mean, I got mine so long ago, there was much less known about it. But now, really, really, truly, it is safe. It is safe. We've had 1 billion people in the world vaccinated. That's a lot of people.
I mean, and how much more does it need to be tried before you recognize that there's a whole
Yeah.
lot of safety measures that have been placed into it. I think what we're talking about right now is really a great question, because taking the vaccine ought to be a no-brainer, but yet there's still a lot of hesitation, and some of it a little crazy to me, implanting chips in us and things of that nature, trying to find another control mechanism, or trying to keep up with all kinds of things. No, this this vaccine was created for everybody, no matter what walk of life you come from, to help prevent this virus from wiping out this planet. And at the
Yeah.
rate it was
And I think
going, it could have done that.
it was going to, oh, it was going to. There's no question. Yeah, it was on its way. It's a good little virus for that. Because the reason it became a pandemic was, remember, is that you didn't know you had it and you were like giving it to everyone around you for a good 5 days. The only
Right.
one that's better is measles. And that's why we have, right, measles outbreaks. The second there's even like 3 or 4 people who don't get their vaccine, poof, right, you get these outbreaks in these cities. But you know what I really wonder about, and I feel like you're the expert in the room about this, right? Is community, right? We're social beings. We need each other, and your expertise is in creating community and keeping it together. And I think that got pretty broken during the pandemic, and I think we're going to take a while to come back from that. And I'm wondering if that vaccine hesitancy is related to that. That people just don't feel connected. They got isolated. They got very alone. And I don't know about anyone else, but I get a little weird if I'm alone by myself for too long. And you start, those like 4 a.m. thoughts where you start to think crazy things, and you wake up and you're like, what was that all about? Right? I do not have a brain tumor. Why was I convinced at 4 o'clock in the morning, lying there in the dark, that I had a brain tumor? I feel like that's kind of what happened to all of us as a society. We've all went a little crazy. We all just got a little too alone.
Yeah, and right, and because it's not normal for us to really be alone under normal conditions. And when you think about for close to 15 months, we've been locked up. And if you're fortunate, if you have somebody else, that you've seen the same people over and over and over and over and over again.
Mhm.
And when I think early on, when we were not even going out of our homes, um, that got a little rough. And so the other day I was driving through some neighborhoods, and I was looking at children outside playing, and people barbecuing in their yards. It was a beautiful day, and there was a sense of normalcy, but we still have to keep in mind we're in a new norm.
People who have had a really strong reaction to the first dose, and probably a lot of those folks actually had COVID. And there's a fair number of people that never, I didn't know if I had it in early March. I think I did, but I have no way to prove it. And I never got tested because there wasn't a test. It was before the world fell apart. You actually are, the CDC is actually pretty clear. Like, you're actually safe to stop at 1 dose if you have had COVID. You don't have to get the second dose of the Moderna or the Pfizer, particularly if you had really strong side effects from it. But we're not kind of giving that room right now, because everybody's so worried about getting to the vaccination
Yeah,
rate that keeps us safe. But remember also that we have a lot of people, the majority of my patients who aren't getting vaccine right now, it's because they had COVID. So I would say, if you've had COVID, wait at least 4 months, but then do go get the vaccine and get at least 1 dose, because your COVID isn't going to protect you against the stuff coming in from other countries like India and Brazil and, right, all over the world. It's going to start to, right? People just don't stop traveling, and we're going to start traveling, right? Because we're so fortunate to have this vaccine. But
absolutely. Right. Yeah.
but I would say, right, but the vaccine does protect you against the new kinds of COVID, and they've actually tested it, particularly the Johnson and Johnson. So if you're really thinking about the future, the Johnson and Johnson is the only one that was tested with the variants that are running around the world now. So that is actually, going in and getting the Johnson and Johnson if you've already had COVID is actually a great idea, because you're one and done. You don't have to get into the whole 1 dose, 2 dose thing, and then you're protected against the future. And that's actually our responsibility. So if you count the number of, say, it's like 20% of people in Massachusetts, and it's about 50, maybe 15% of people in Massachusetts got documented COVID. Maybe you could bump it up to 20 for the people that got it but didn't know. And you're at 68%. That would be 88%. We're pretty close to doing okay. I think that's why we're seeing the numbers drop. But
Yeah.
what I'm worried about is that there's a groups of people that hang out with each other that are not getting vaccinated, right? That's what I worry about, is when you get these little communities of folks, right? College students that just don't want to do it, people who are working together on a job, and everyone's kind of got this, right? This like ethos of like, no, not me. Young people, right, who hang out together a lot socially. I think those are lots of people who are undocumented are still afraid to get vaccine because they're still afraid it's somehow going to be traceable. That just breaks my heart, right? It's so I think we really want to make sure that those groups of people have access, and that's partly what these events are about, is bringing the vaccine to you, so that even though it sounds easy to walk into a Walgreens or a CVS, and you can literally just walk in now and get your vaccine. It's
Right.
still a decision. It's a little bit of work, and it's a lot easier if we just bring it to you, right? You're at church anyway, or you're walking by, and you hop right in this little vaccine van, and off you go. You're done. You don't have to plan it. You don't have to think about it. Um, and so I'm really excited that we are giving these opportunities.
Yeah. It's so much more convenient today. And
Hmm.
there's really no reason not to be vaccinated. People just have to get over the hurdles they have to get over, and we want to
Hmm.
those of you who are watching, we want to encourage you to, if you have not thought about getting the vaccine, rethink it. We want to get as many people vaccinated as possible. And it's not just for you, but for the survival of us all. Um, we're not out of it. We'll never really be out of it. It's a disease that it will be around for a while, not a disease, but a virus that'll be around for a long time, and with other strains coming to it. And so, please, ma'am, please, sir, give it some serious thought about going and getting that first shot, and then getting the second shot, unless you're doing the J&J, Johnson and Johnson. So, doctor, there are so many things that we can talk about as far as how long it will last, how long will we be protected by it, and I think you had mentioned that it's doing so well. I heard the other day that we may not need a booster shot at the end of this year. You
I,
know,
I think scientifically, there's folks who are infectologists, which is a wild term, right? So they basically just study diseases all day, and they're super smart. And boy, is this their moment! They're so happy. I mean, they're happy now that they get to talk about the thing that they love. They're clearly not happy we had to have a pandemic to do it. But my favorite one, I think I mentioned her before, is Dr. Monica Gandhi out of UCSF, and she's actually she's gone viral. Because she's awesome. I love her. And she says a bunch of things, right? She's basically said, like, look, we've got to the point where we can probably let masks go as long as you're outside. This is not an outside virus, this is an inside virus, so I think we're good to go. And and really, these are we're the luckiest we've ever been, because these vaccines are so incredible. And it really is time for us to make sure, though, that people get the vaccine, because that is our best protection against the future. And she really doesn't believe that there's evidence right now that we're going to need boosters.
we're doing well in the United States, but we do know that this is a global situation. And if you're planning on traveling, remember, there's no place in the world where this has not affected people. And they may not be at the level that we are in the United States. We just heard where our president is getting ready to send massive doses of the vaccine to India and other parts, and they need it. And you're talking about, look, folk were dying so quickly, there was just really no place to put people. And we
Yep.
remember back when we were at the height of this in New York, when they had to bring refrigerated trucks just to store
Hmm.
the bodies. That's a
Yeah, and
sad
you don't
state of
get to
affair
say
to be in.
goodbye. And you don't get to say goodbye, right? Can you imagine? I mean, I can't imagine, right? Because I actually have patients that I've had to experience this with and alongside, and seen it. But you don't get to say goodbye. Someone just disappears out of your life. Like, that's some heavy trauma. And we have big communities in Boston, because we're very proudly, I think, an immigrant city. We've got big communities who are here, who's still have relatives in India and Nepal, in Brazil in particular, countries that have been really hit hard. And so one of the other things I say to folks from those communities is, please get your vaccine quickly, because we need to send vaccine to your relatives in those countries. We need to protect your family in those countries, so that we can actually be responsible citizens of the world.
This conversation that we've been having tonight is really based on informing people that the vaccines are safe and they're necessary. And we here in the Commonwealth and wherever this may be aired need to take very seriously that the thought that it has brought us to this juncture, and it can take us a lot further if just the rest of us who have not been vaccinated get vaccinated. So look at your local municipalities, your city, your towns, and see what's going on. Many of them are doing something every week to make sure that there are mobile units, there are sites that have been set up on the weekend, um, all kinds of places. You can go, I don't know, can you go to Walmart? You can go for everything else. Can you go to Walmart and get a vaccine?
Almost anywhere with a pharmacy. Yeah. There's
Okay.
not a lot of Walmarts in Massachusetts, but you can certainly go to Walgreens, CVS. You can certainly go to any of the CHA pharmacies. You can probably go to, I'm guessing, any of the hospital pharmacies and the major hospitals. So yeah, it's pretty easy. And I think it's time. It's time.
Oh, it definitely is.
There really just aren't any doubts, right? You're not going to get magnetized. You're not going to become infertile. You're not going to get superpowers, sadly, other than not dying. That's kind of a superpower, just like we talked about. So go for that one. Go for the not dying superpower.
Yeah, it's all about life, not death. And so I've enjoyed talking with you tonight. Once again, I enjoy our conversations. I often laugh when you let everybody know that you're a self-professed nerd, and I would dare anybody else to say that. I just think you're a woman who is very passionate about what she does, and you leave no stones unturned. So again, I want to thank you for sharing a wealth of information with us, what you have learned and what you're sharing with us to learn, so that we can become very proactive in helping to stamp out as the best that we can this virus who had taken so many away from us too soon, too early. And CHA
And
is doing an excellent job in making sure the word gets out. And we want you to know that on the 26th of this month, Saturday at 8, from 8 to 12 in the city of Everett, behind Zion Church Ministries in the parking lot, there will be a clinic being held with trained staff there to make sure that vaccinations are available to uh, whoever. So if you just contact CHA, or you can contact us at Zion Church Ministries. You can go to our website or our Facebook page, which is Zion Church Ministries, and leave us a message. You can call us at area code 617 389 8357. If no one is there at the time, leave us a message and we'll make sure that we get back to you. We want everybody who's eligible, and that's all who have not gotten shots as yet, who are eligible to come on out. And I guarantee you, you will not regret it. So, Dr. Messenger, we thank you so much again. Um,
it's an honor.
keep the fight up. Keep the, just
Uh,
keep the
you,
word getting out
I'm
there.
good for that. I am good for that. I'm good for nerd and I'm good for fight. Thank you. It's an honor to be asked. I truly enjoy my conversations with you as well. And thank you so much, really, from the bottom of my heart, for being so generous with your time and your energy and your church, and for hosting and for just doing good in the world. It's a pleasure and an honor.
Okay, well, thank you again so much. And remember, that's the 26th of June from 8 a.m. to 12 p.m. behind Zion Church Ministries, sponsored by CHA, Zion Church Ministries, and Oliveira Steak Bar and Grill. We're looking forward to seeing you there. God bless. Stay safe. Go get vaccinated. Have a great day. Bye-bye.